Alright, so this is a wrist taping video to block wrist extension. So often when we are, and when we have some irritation through the wrist, we're trying push-ups and weightlifting and things like that. This movement, wrist extension, can be quite aggravating. So this is a video to block that. So what we want to do is get the patient or the wrist into about 15 degrees of wrist flexion. So that's this way, bringing them not too far, just to get that 15 degrees bend through there and getting them to hold there. Again, 2 bits of Fix-A-Mole and some rigid tape. And so the things we're looking to do is obviously block that wrist extension, but we don't want to tourniquet the wrist and block off circulation. So the idea with this is that we're going to tape the wrist, but we're not going to go all the way around for the supporting. So the wrist bones, actually some of the carpals and the metacarpals sort of finish around here. So we actually want to tape across this crease here, right about there, and then just again pressing down. And you'll notice with this tape, if we turn it over, there'll actually be a little bit of a gap, and that's okay because that's all we are going to tape with the rigid. So making sure they're in 15 degrees, grabbing some of the rigid tape. Now again, we only want to go we don't want to go all the way around the wrist. So finding sort of finding that anchor point here. Taping down, getting it relatively tight across those 2 areas, and then blocking down. Again, looking at that wrist here, we're not actually taping all the way around. We don't want to tourniquet the wrist. So again, finding them back into that wrist extension, wrist flexion, sorry. We'll go again. Again, you can go, because we're not going all the way around, you actually can support this quite tight. So again, I like to find the anchor point there, make sure it sticks nice and tight, and get a fair bit of purchase on through here and around the other side. And probably one more a little bit further up that wrist there. And we really want to block that and finding a bit of purchase and then locking off the end. Now, if you've got some stretchy tape, that's where we could go around the wrist. We do want to lock it off, but we can test that here by getting them to go into wrist extension and feeling that that's blocked. You'd often ask them, does that feel, how does that feel compared to before? And then we're going to today just use some Fix-A-Mole to lock it off. As I said, if you've got some, you generally use stretchy tape. It makes it look a little bit neater as well, but Fix-A-Mole will do. So get them back into neutral, and then just basically locking over, and if they turn their wrist around, you can make sure that it goes all the way across. This doesn't need to be tight. We don't want this to be tight. So this is allowing these tendons through here some freedom and space. Again, we want to check for circulation and discoloration. A couple of days to leave this on, but generally you would now then test their wrist extension, so it's blocked through there, and then test test your whether it's a push-up or something like that you're trying to help out. And that's it.